I want to go over the instructions one more time.
I am a single mother, raising 2 teenagers, and I have a really busy lifestyle, maintaining home and working full time.
Anyone else need any assistance?
Robin has uterine fibroids, and uterine fibroids are a very common problem. So we'll do a brief exam. They're not life-threatening, but they cause a tremendous amount of symptoms for reproductive age women.
I was having heavy menstrual flows, terrible cramps. I had extremely large abdominal swelling where the fibroids had made my uterus protrude, and my students were asking me, was I pregnant? And I was a wee bit embarrassed because I wasn't.
It's estimated that up to 80% of women can silently have fibroids, and up to 1 in 4 women have fibroids big enough to see or feel or cause them problems.
I'm here to participate in a study for African American women.
African American women get more fibroids and are more symptomatic than any other group. And so we felt it was important to go back and have a separate trial dedicated to evaluating the disease in that population.
I found out that a lot of women can live with fibroids as long as they have a way to soothe the symptoms.
Focused ultrasound is a really new technology. And in fact, fibroids are the first disease that have been able to be treated with this kind of treatment.
It's completely non-invasive. It's a thermal way of heating the tissue using ultrasound waves that pass through the skin. So we call it scalpless surgery or bloodless surgery.
I hear so many times that women have hysterectomies unnecessarily, and I just didn't want to be one of those statistics.
The treatment itself takes place in an MRI machine, so you can monitor where the energy is going, how much is being absorbed, and also be able to look at all of the important structures around the uterus, the bladder, the bowel, the pelvic nerves, and make sure that those stay safe.
She's 50 years of age, so she's obviously very close to menopause, and the goal of this treatment is to alleviate her symptoms enough to avoid a hysterectomy and get the patient to menopause, where her symptoms should obviously considerably regress and go away because of the hormonal change. Inside her uterus, we have large black circles, and each of these large black circles represents a fibroid or a leiomyoma. And you can see these range in size from 4 to 5 to 6 centimeters. The one that we're targeting for treatment today would be this one here, and this is the cause of a lot of her symptoms. Once the procedure starts, the actual sonications are delivered through the skin using the ultrasound transducer, focused into the fibroid, and they raise the temperature locally up to about 70 degrees. And this, of course, causes cell kill or coagulation of the tissue. And we do that repeatedly with multiple sonications for a 3-hour time period.
The reason why I opted to have this particular procedure because it was non-invasive, it didn't leave any scarring.
Clearly, it's a huge advance in the field of surgery to be able to do surgery without making incisions in the very first place. And I think it's a huge advance for image-guided therapy.
I was up walking around like I went out to lunch after the procedure.
The actual treatment for fibroids, of course, it's a huge advance because here now we have a non-invasive option that allows the patient to be treated without the fear of surgery or recovery time being significant, as it can be for UAE or myomectomy, or for hysterectomy, can be as long as 6 to 8 weeks out of work.
If you need cups for water, they're under the sink.
We have probably treated over 250 women through our clinical trials. We do have an international office that can facilitate coordination.
Cut in here and overlap it.
It took down the swelling of my uterus, and it took away a lot of that bleeding. I don't have chronic fatigue like I used to. The care that I received at Brigham Women's Hospital was phenomenal.